So again, I'm Dr. Andrew Monte, and I will be presenting about the PhilHealth Outpatient HIV/AIDS Treatment Package. So next slide. So this is the outline of my presentation. Next slide. As you all know, PhilHealth implements the National Health Insurance Program. So our funds or are pooled from the contributions of our members, which is essentially all Filipinos, either contribute through direct contribution or through indirect contribution as sponsored by our national government. So in turn, all Filipinos were covered by the National Health Insurance Program. And we accredit providers, or the hospitals, HIV clinics, including, to provide services for our members. So in turn, for all these services, we reimburse them. Next slide. So our PhilHealth benefit ranges from primary care, outpatient, and day surgeries, and we also have some benefits for catastrophic conditions. Next slide. So in 2018, the Universal Healthcare Act was enacted. So it's an integrated and comprehensive approach to ensure health literacy, healthy living, and protection from hazard and risks. It adopts a whole of government, whole of system, and whole of society approach, people-oriented, and it adopts a healthcare model that is comprehensive. So it is not just inpatient, but also promotive, preventive, curative, rehabilitative, and all the care within the spectrum. Next slide. So these are the objectives of the Universal Healthcare Act. So take note to progressively realize universal healthcare through systematic approach and clear delineation of stakeholders, of the role of the stakeholders. So there's the word progressive. So since the start, we have been working towards this progressive realization. Then another objective is to ensure equitable access to quality and affordable healthcare and protection against financial risk. Next slide. So in the Universal Healthcare Act, the covered population under the National Health Insurance Program are all Filipinos. No? So all Filipinos or every Filipinos are included in the National Health Insurance Program, and there is immediate eligibility for and access to population-based and individual-based health services. Next slide. So in terms of coverage of these services, the population-based health services will be free and funded by the Department of Health, while the individual-based health services are funded primarily through prepayment mechanism. When we say prepayment, there is pooling of funds beforehand or contributions, such as through PhilHealth or the Social Health Insurance Program. Next slide. So the service delivery, PhilHealth will be contracting public and private health care provider network that would agree on service quality, co-payment or co-insurance, and submission of data for individual-based health services. Next slide. Now, I will just touch some salient points of the law, which is first is the role of the health technology assessment in priority setting. So this is already institutionalized under the Universal Healthcare Act, such that investment or any health technology or development of any benefit package by PhilHealth shall be based on a positive recommendation of the health technology assessment. Next slide. And as to the entitlement of benefits under the National Health Insurance Program, there's immediate eligibility, but policy would say that there should be updated premium contribution. There is also no co-payment in basic or ward accommodation. but co-payment for amenities in public hospitals, and there is no reduction in current PhilHealth benefit packages. Now, this is one of the main points of the Universal Healthcare Act, which is expanding the primary care benefit, which we now call Consulta. So Filipinos, all of us, will be registered or should register in accredited primary care provider through either through this. The only available now is through assisted, where you go to the nearest PhilHealth local health insurance office. Then later on, self-registration platforms will be available. Then once you're registered, you will have to consult through various modes of service delivery. And these services, next slide, are covered under the Consulta package. Next slide. Also, the Universal Healthcare Act provides that a comprehensive outpatient benefit package will be developed. So the starting point for now will be the primary care benefit. Next slide. Then another provision is the contracting of healthcare provider network, for which they will be offering comprehensive care in an integrated and coordinated manner, and this will be contracted by PhilHealth. Next slide. Then PhilHealth will also be reforming the provider payment for the manner we pay or we reimburse a provider using these principles: performance-driven, close and prospective payment using DRG or diagnosis-related grouping and validated costing methodology. Next slide. So the DRG-based payment or diagnosis-related grouping payment based payment will be used in reimbursing hospitals later on. So there will be a patient classification system. So this will be based on a patient classification system using a set of characteristics, like demographics, diagnosis, procedures, and length of stay. And then it will be also using performance-based capitation for primary care. And then later on, when there are healthcare provider networks, this will be a DRG-based global budget. Next slide. So this is how we envision the healthcare provider network, with primary care facility as a starting point, as a navigator and gatekeeper of our PhilHealth members as it goes through the different services and different levels of health care within the network. Next slide. Now I will go to the outpatient HIV/AIDS treatment package. So this is a standalone package at this time. So it started in 2010 as an outpatient HIV/AIDS package as part of the commitment of PhilHealth to support the Millennium Development Goals. There were subsequent revision until last year. Next slide. So the benefit covers or the coverage is maximum. So this is a maximum of 7,500 per quarter for HIV-related services. This can be availed by confirmed HIV/AIDS that needs treatment based on the DOH treatment guidelines. This can be availed of from accredited HIV facilities and the care were given by accredited doctors. Next slide. So as I said, this is a maximum of 7,500 per quarter for HIV-related services, and the services are based on DOH treatment guidelines, including counseling, consultation, initiation and maintenance of ART, early diagnosis of TB, monitoring, and prevention of and management of treatment failures. Next slide. So these are the services in detail, as listed also in the circular. about outpatient HIV/AIDS treatment package. So next slide. So who can avail? Those that are confirmed HIV/AIDS by RIVDA, by SACL, or by RITM. And they require treatment, which is at this time, per DOH standards, treatment is started once confirmed. So hence, in filing claims, we are requiring a copy of confirmatory result as well as the ART regimen booklet. So next slide. No, enrollment and eligibility under the National Health Insurance Program, uh, as the Universal Healthcare Act mandates, every Filipino shall be automatically included into the National Health Insurance Program, and they be given grant immediate eligibility for the health benefit package under the program. Hence, uh, for OHAT, unlike before the universal healthcare that we are requiring a period of contribution or membership, it is not a requirement anymore. But premium contribution will be billed accordingly. Then patients not yet enrolled in the program should accomplish uh, patient member registration form for registration to the National Health Insurance Program. Next slide. Now, based on the standards of care, it should be according to the DOH treatment guidelines. So antiretroviral therapy should be initiated in all persons with confirmed positive HIV test results, regardless of clinical and immunologic status. And I would like to add, regardless whether they are already registered to PhilHealth or not, because the ART were or are given or supplied by the DOH. And this is already included in the treatment guidelines. Then, based on the standards, there should be monitoring of toxicity as well as response to treatment and management of co-infection. Next slide. Where to avail? We have accredited HIV care facilities. So this includes our accredited facilities for other services that are certified or recognized by the Department of Health as HIV treatment facilities. So this includes hospitals and some TB dots clinics but in 2018, we also accredited standalone HIV/AIDS or HIV treatment facilities. Then for the health professionals or the doctors who will sign the claim must be PhilHealth accredited. Next slide. So these are the requirements for accreditation in summary. So for those facilities that are already accredited, like a hospital, they only need to submit a new performance commitment that includes OHAT as one of their services. For those that are not accredited and only providing HIV services, they can or they may apply as a standalone HIV/AIDS treatment hub. Next slide. Okay. I included these slides to remind the facilities that at this time the validity of accreditation as a facility is 1 year. So it always ends in December. So come before December, or I think 60 days prior, there should be filing for renewal already, or applying for renewal for the accreditation to continue. So these are next slide. These are the requirements for standalone HIV facility. So most important here is that the facility is included or is recognized by the DOH as HIV treatment facility, which is listed in DOH memorandum, which they release at least every year. Next slide. Now, the performance commitment, no, in case they need to change, no, because they are now recognized as HIV facility, it may be downloaded in PhilHealth website. Next slide. Okay, I will go now to other matters of OHAT. Next slide. So these are the requirements for claims filing. So at this time, submission of OHAT claims is still manual, so in paper form. But come 2023, we will be transitioning to e-claim submission. So these are the requirements, no? So PBEF, which will indicate whether the patient is eligible or not. So it should indicate yes. Then duly accomplished claim form 1, which is no longer required if the PBEF will indicate yes. Then duly accomplished PhilHealth claim form 2 and statement of account. Next slide. Then these are the other requirements. So the confirmatory result, health regimen booklet, and waiver and consent for release of confidential information. Now, for succeeding claim, they will be submitting a waiver also and a copy of the health regimen booklet. Referral letter in case of transfer. Next slide. The policy on OHAT indicates how its payment will be allocated. So 80% for the healthcare institution for the services it provided. So all in case there is laboratories, supplies that were used and need to be reimbursed to PhilHealth, even the delivery or the courier services will be charged from the 80%. Now the 20% will be for the staff for their professional fee. We added this to support the continuous provision of ART in case of stockouts or problems in the supply. So for uninterrupted supplies and continuous intake of ARV, then in cases that the facility need to procure its own drugs, then they can also charge it to OHAT under the facility or healthcare institution. Then the alternative modes of delivery of supplies may also be charged, like when there was a lockdown and they have to use courier services. Next slide. Okay, this is important. So on the part of the member or the client, so in case they have concerns, they can call our self-help hotline, or in case they need a specific answer, they can use the callback channel wherein our agent or our action center will call them usually within 3 days. Then for further information, you may visit our website in this address. So next, okay, that's the end of my presentation. Thank you very much.